Hi, I'm Dr. Nick Quinn, and today we're going to discuss post-surgical sacral base unleveling, or easier, post-surgical short legs. So for time's sake, we're going to focus on a case study of one of my patients who just recently had a hip replacement surgery. And so hip replacements, along with knee replacements, are among the most common orthopedic procedures performed in the United States. Approximately 1 million hip and knees get surgically replaced every year. According to the first nationwide prevalence study of hip and knee arthroplasty, roughly 7.2 million Americans are currently living with implants from hip and knee surgeries. And so when I get a patient who has a hip or knee replacement, I always want to take a lumbar pelvic view. And so when I take an AP lumbar x-ray, I take a modified Ferguson view to account for the sacral tilt. What I'm looking for is a level sacral base, which looks like this. The sacral base is the table at which the rest of the spine balances. If the table is crooked, so is the rest of the spine.
Oh no!
So here's an x-ray of a patient before his hip surgery. Here he is after. Notice the drop in the pelvis on the left side. Now this isn't exactly rocket science, yet so many short legs go missed because people simply just aren't looking for it. But think about it. What happens to your brake pads when your car is out of alignment from hitting potholes all spring? Or have you ever tried walking around with just one shoe on? When one leg is shorter than the other to the point where it's causing a pelvic deficiency, it puts your spine in a pseudo-scoliotic position. And so Wolff's Law states that bone in a healthy person or an animal will adapt to the loads under which it is placed. And so if you take an unbalanced pelvis or an unbalanced spine, you combine that with the gravitational forces of your mass, you put that over time, and what do you get is spinal decay. So how much decay your body has, or your spine and pelvis and hips have, is dependent on many common factors, such as your body mass, levels of inflammation present from your diet or from the environment, your muscle tone, your mobility, your hydration, nutritional deficiencies, amongst many other circumstances. This can then lead to things like back pain, neuropathy, numbness and tingling in the lower extremities, leg pain, leg weakness, in severe instances, bowel and bladder issues, amongst any other symptom involving the central nervous system in regards to the lumbopelvic region. A lot of times we can correct this deficiency with a simple heel lift. These cost $6 and can do a great job of balancing out the pelvis for very little cost. So if you or a loved one has had a hip or knee replacement and still suffers from back pain, it's possible they may have a post-surgical short leg. And I always tell my patients, I can adjust your spine every day for the rest of your life, but I cannot grow your leg. So if you have any questions in regards to this topic, feel free to comment below. Otherwise, for appointments, you can visit www.audiosucks.com. If you don't live in my area and are searching for a chiropractor who looks for these sorts of things, check out the link below at idealspine.com. And of course, don't forget to like and subscribe. Cheers.